If you flew through Newark last month, you might have walked right through an invisible cloud of measles, and you won't know for weeks. That's the unsettling reality the New Jersey Department of Health dropped on Friday, and it's already sparking heated debates online about airport safety, vaccine responsibility, and how much warning travelers really deserve. Here's the timeline health officials want burned into your memory. Terminal C, Monday, July 29th. Between 5:30 p.m. and 9:30 p.m. Terminal A, Tuesday, July 30th, between 1:30 p.m. and 7 p.m. If you so much as grabbed a coffee, used a restroom, or waited at a gate in either of those windows, you're officially in the possible exposure bracket. And here's where it gets controversial. The virus can hang in the air for up to 2 hours after the sick person has already boarded their flight and disappeared into the sky. That means you could have entered an empty gate area and still inhaled enough virus particles to get infected. But wait, there's a catch most people miss. Symptoms may not crash the party until August 20th at the latest. That's nearly 3 full weeks of feeling perfectly fine while unknowingly carrying one of the most contagious diseases on the planet. Imagine heading back to work, dropping your kids at summer camp, or visiting elderly relatives, all while contagious. It's the plot of a slow burn thriller, except it's real life. What should you do if you fit the exposure window? Health officials are crystal clear. Do not march straight into a crowded urgent care waiting room. Instead, pick up the phone first. Call your local health department or your primary care doctor. Explain the situation and let them guide you on next steps. This simple courtesy protects babies too young to be vaccinated, cancer patients, and anyone else whose immune system can't take a hit. Behind the scenes, the New Jersey Department of Health and county health teams are running a full-scale contact tracing marathon. They're pulling flight manifests, gate seating charts, restaurant receipts, anything that can help them reach passengers who may not have seen the headlines. If your phone rings with an unknown 609 or 732 area code, it might be a tracer trying to keep you and everyone you love safe. Let's break down the measles playbook for beginners. Transmission: a single cough or sneeze launches respiratory droplets into the air. The virus can survive suspended like microscopic glitter for 2 hours. Early warning signs: high fever, often 101 degrees Fahrenheit or higher, cough that feels like a bad cold, runny nose, and eyes so watery you'll swear it's allergy season. The telltale rash: red spots typically crash the party 3 to 5 days after the first symptoms, starting at the hairline and racing downward. Despite the scary headlines, officials stress that no new cases have popped up yet. But here's the provocative question that's lighting up Twitter threads. Should airports install real-time air quality sensors for viruses the same way they scan for explosives? Some say it's Big Brother overreach. Others argue it's the logical next step in a hyper-connected world. Dominique Jack, a Brooklyn-based digital producer who joined Pix11 in 2024, broke the story. With more than 5 years of watchdog reporting under her belt, she's become the go-to voice for turning dense health alerts into plain English warnings. You can dive deeper into her coverage here, https://pix11.com. Now, over to you. Do you think travelers deserve automatic text alerts the moment an exposure window is announced, or is that just alarmist? Would you support vaccine checkpoints at domestic terminals, or does that cross a civil liberties line? Drop your take in the comments. Agree, disagree, or bring a totally new angle. Let's talk.